the continent through the media on the happenings of COVID-19 and Africa's CDC's response to the pandemic across the continent. We'd like to welcome you, our members of the media, as a very key partner to this process of COVID response on the continent. Our briefing, as usual, is going to have two segments. First, we're going to have the briefing from the director. Today, we have Dr. Ahmed Odwell-Ohuma. He's the acting director of Africa CDC. Dr. Ohuma is going to brief us in the first segment, covering key aspects of the COVID response that includes cases and the management of cases across member states. He will also touch on the issues of testing across the continent, and of course, the issue of vaccine and vaccination as the continent targets to reach the 70% target rate for vaccination across member states. Dr. Ahmed will also touch on the issue of the monkeypox outbreak in some countries across the continent, as he did last week. And then our second segment will include the question and answer section, where you members of the media will put forth your question to the director and he will provide the adequate response where necessary. So for the question and answer segment, we usually have 3 channels through which you members of the media can post your question. The first one is our usual WhatsApp number, that is +251 94 2310. I read that again, +251 94 2310. Let me read that the last time. +251 94 2310. That is the first channel for our question. The second one will obviously be the live section of the Zoom platform, which you will use the raised hand icon at the bottom of your Zoom screen, and then we will permit you to speak.
Choose what happens with the device.
And we will permit you to speak and put forth your question. And the last channel will be, of course, the Q&A section on your Zoom platform, where you can just write out your question. Of course, let's remember to indicate our name and, of course, the institution we work for. Today's briefing is live on several platforms. That is the African Union Commission live stream platform. You can follow that. And the second area where you can follow the briefing is also on all of Africa CDC social media platforms that include Facebook, Twitter, of course, YouTube channel. You can follow us live on those different channels. We usually have our French to English, English to French interpretation. Based on your choice of language, you can choose either of them to follow the briefing. So with this information, let me just hand you over to our host for today, Dr. Ahmed Odwell-Ohuma, the Acting Director of Africa CDC, for our briefing, the first segment. Director, it's over to you.
Thank you. Thank you very much, Nick. And good morning, good afternoon, good evening, wherever you are joining us from. And welcome to today's press briefing, coming to you here from the Africa Union headquarters in Addis Ababa. I would like to start by sharing some overview in terms of updates on COVID-19 as of June 16th. Today, the total cumulative number of cases that we have documented on the continent is 11,700,000, which accounts for 3% of the total number of cases reported globally. The recoveries, we have just over 11 million, which accounts for 95% of all the cases reported here in Africa. While deaths, we have documented 253,682, which gives us a case fatality rate cumulatively of 2.2%, and this accounts for 4.1% of all the deaths reported globally. In terms of the spread of cases, 61% are reported from 5 countries, and that is South Africa with 34% of the total reported cases, Morocco with 10%, Tunisia with 9%, Egypt and Libya both with 4% of the total reported cases on the continent. In terms of the case fatality rate, this week, 39 countries, which represents 71% of our member states in Africa, are reporting a case fatality rate that is higher than the global average of 1.2%. In terms of, excuse me, in terms of very high rates, Somalia and Sudan are still the only 2 countries reporting a case fatality rate that is higher than 5%. In terms of waves, since our last briefing, we do not have any additional country that has experienced a 3rd wave. Neither do we have any additional countries that have experienced a 4th wave. However, 3 additional member states, that is Cabo Verde, Ethiopia, and Morocco, are experiencing a 5th wave. 2 countries, Kenya and Mauritius, are experiencing a 6th wave, and Kenya is the additional country that is experiencing a 6th wave here in Africa. When we look at the trend over the last 1 week, we see that we have documented a total of 29,077 new cases, which is a 3% increase when compared to the previous week. The highest proportion of the new cases is from Southern Africa region, which accounts for 48% of these new cases. In terms of the highest numbers during this week reporting new cases, we have South Africa with 10,385, Morocco with 5,410, Ethiopia with 3,951, Kenya with 1,591, and Zambia with 1,076. In terms of new deaths, we have documented a total of 203 new deaths, which, when compared to the previous week, when we documented 222, it represents a 9% decrease in the number of new deaths during this epidemiological week 23, that is from 6th to 12th of June 2022. When we look at the 4-week trend, we see that new cases have seen an overall 15% decrease when we compare to the previous 4 weeks. In terms of regional breakdown, when we look at the 4-week trend, 54% increase in North Africa, 50% increase in Eastern Africa, 42% increase in Western Africa, 4% increase in the Central Africa region, and a 28% decrease in Southern Africa region. When we look at the most populous countries in Africa, the situation is as follows. Ethiopia, 114 average increase. Kenya, 92% average increase. Nigeria, 40% average increase. The DRC, 26% average increase, while Egypt has a 60% average decrease, and finally South Africa with a 32% average decrease. When we look at new deaths over this 4-week analysis, we see that there's been an overall 5% average decrease in the number of new deaths reported during this period. When we look at the most populous countries in Africa, South Africa reported a 6% average decrease, while Egypt, Ethiopia, Nigeria, and Kenya did not show any change in the number of deaths. Let's look at the COVID testing and medical supplies situation. To date, we have seen 109 million COVID-19 tests conducted in Africa since the beginning of the pandemic. And during the week 23, we have seen 366,457 tests being done. And this represents a 28% decrease from the previous week, when we had over 508,000 tests being done across the continent. Cumulatively, the positivity rate is 11%, while the test per case ratio is 9.4%. For this epidemiological week 23 that we are reporting on, the positivity rate is 8%, while the test per case ratio is 13, which shows an increase in the positivity rate by 42% and a decrease by 30% in the test per case ratio. 11% of the member states in Africa, this comprises 6 countries, Cabo Verde, Ethiopia, Ghana, Morocco, Namibia, and Tunisia, are reporting a test positivity rate higher than 12% during this EPI week 23. Shifting to vaccination, to date, a total of 824 million vaccines doses for COVID-19 have been procured in 54 of our member states. 590 million of these COVID-19 doses have already been administered, which corresponds to 71.6% of the total supply that has come to the continent. However, our average coverage still remains low at 17.6%, utilizing the new data that I reported on last week, that we're using the 2022 projected population data now, and it gives us 17.6% of the population being fully vaccinated here in Africa. The top 10 countries, in as far as vaccination is concerned, are the Seychelles with 80.6, Mauritius 76.5, Rwanda with 63.1, Morocco with 61.7, Botswana with 61.5, Cape Verde with 54.7, Tunisia with 52.7, Mozambique 43.4, Sao Tome and Principe with 40%, and Lesotho with 38.6%. In terms of boosters, 37 countries on the continent are offering booster doses for different groups of those that are eligible based on local protocols. The situation is still the same, with only 2 countries in Africa, and that is Tunisia and South Africa, offering a second booster dose for those who are 50 years and above. Let's move now to monkeypox. The situation in Africa today is as follows. We have documented since the beginning of this year, 2022, 1,597 cases, and this is as of the 16th of June 2022, with 1,488 of those being suspected, but with the clinical signs that mimic monkeypox, and 109 cases have been confirmed in the laboratory. We've documented 66 deaths, which gives us a case fatality rate of 4.1%. These 1,597 cases have been reported from nine of our member states, 8 of them being endemic for this virus, while 1 is a non-endemic country, that one being Morocco. The countries that have reported confirmed cases are Cameroon, the Central African Republic, Congo Republic, the DRC, Nigeria, Morocco, Ghana, Liberia, Sierra Leone. As Africa CDC, we continue to update our assessment of the situation, and in terms of the geoscope assessment, where we look at how spread this particular virus is across countries on the continent, we say that the assessment is high because it is found in quite many countries on the continent. When we look at the risks, we are assessing that at moderate, because monkeypox is not easily transmissible, is self-limiting, with relatively low mortality rates, and treatment is effectively providing support to those who have been identified as having monkeypox. So our risk level is moderate. We are working with the affected member states to put in place a One Health approach, and ensuring that the Emergency Operations Center remains very alert and collecting information from our member states. We are also in communication with our counterparts in Europe, in the US, and other parts of the world to ensure that we have the latest information based on what they are reporting. We also can confirm today that our laboratories, with the laboratories of the government in the DRC, Senegal, and Nigeria, are able to do laboratory diagnosis, and we are working with all interested member states of the continent to ensure that the capacity is stabilized, and as many countries as possible are able to do laboratory diagnosis within their own countries. This involves getting the right training and the right reagents so that the laboratory diagnosis can be able to be done effectively. Let me add that this is also the week when our policy organs at the African Union begin to meet to consider different agenda items, including that of operationalization of Africa CDC. We had the health ministers meet last week. This week on Tuesday. They will meet again next week on Tuesday. Then the ministers of Justice and Legal Affairs will follow a week after, before we go into our permanent representatives committee and eventually the Executive Council in July of 2022. So this is the update from our end, and we are happy to take questions from the floor. Thank you, Nick. Back to you.
Thank you, Director. Very comprehensive update there on both the COVID-19 situation and, of course, the monkeypox outbreak in some parts of the continent, in specific countries that were mentioned. Of course, the endemic and the non-endemic countries such as Morocco that was reported last week. This will lead us straight into our second segment, which is the question and answer segment. As we said, there are 3 channels through which you can send your question. One, our regular WhatsApp number, +251 94550 2310 is the WhatsApp number. And of course, you can use either of the Zoom platform channels. That is one, you use the raise hand icon to come live to us, or secondly, you use the question and answer segment. Question and answer segment, we will begin quickly, and of course, we will say good morning to our colleague from the Kenya Broadcasting Corporation, Judith Akolu, one of our regular colleagues. Judith comes in with her first question, and it's around, of course, the COVID. Like we did last week, colleagues, we're going to segment the questions. Those that are related to COVID, we will ask them to the director, and then we will move on to the ones that are related to the monkeypox situation. So let's take Judith's first question, and because she has 2 actually. Judith says, good morning, my question is, doctors in various hospitals where patients are presenting signs like influenza, fever, pain all over the body with a dry cough are saying there is a viral fever going around in Kenya, which is not COVID-19 nor influenza. Has the Africa CDC received any such reports, and what is it that patients are suffering from? So that is Judith's first question. Mentioning doctors are seeing these signs and symptoms, but they're not linking that to COVID or influenza. Have Africa CDC received any information as such, and what they said that patients could possibly be suffering from? Over to you, Director.
Thank you, Judith. In fact, apart from Kenya, quite a number of countries are reporting an increase in flu-like disease. And at the moment, we do not have any new information that it is anything other than flu. Samples have been collected from across the countries. As you know, it's getting into the cold season now in many parts in Africa. And that comes with some of these influenza viruses. But samples have been collected. They are being sequenced to be able to know what kind of pathogen it actually is. At the moment, we cannot be able to say that it is anything other than a flu, because the symptoms that the patients are presenting with in Kenya and elsewhere are very much flu-like until we get the report back from the laboratory after sequencing. Then we can be able to confirm which type of pathogen it actually is. But we encourage members of the public to maintain good protocols that protect them from these sorts of transmission from person to person through talking, laughing, singing, so that we reduce the exposure and risk of catching any flu-like disease. Thank you.
Thank you, Director. That is the response to your question, of course, with the question to members of the public. We only saw our colleague Sarah Javin, but I think Sarah has declined on her question. So, okay, Sarah has come back. So we will go to Sarah for her question, and then we come back to Judith's second question. I see our colleague Coletta Wanjui is also on. So after Sarah, then we will move on to the other 2 questions. Sarah, over to you.
Thank you so much for taking my question. At DevEx, we published a piece yesterday about WHO Afro objecting to Africa CDC declaring and coordinating health emergencies on the continent. I'm wondering if you can explain whether there would be a difference on the ground for responders with Africa CDC declarations as opposed to WHO declarations. And would Africa CDC's declarations kind of translate into earlier action? What are the key differences? Thank you.
Thank you, Sarah. As you know, before an emergency is declared for any outbreak, we cannot be able to activate our emergency response procedures. At the moment, that declaration of emergency is usually at two levels. First is at the national level. Governments can be able to make that declaration that there is a public health emergency within their own borders. And beyond the borders, then the WHO usually does that at the Geneva level. What the AU policy organs are currently considering to be able to mandate Africa CDC to also within Africa be able to declare a public health emergency if it is of continental security. If that is granted, there will be no difference in as far as response on the continent is concerned. Emergency procedures will kick in, whether the WHO makes a pronouncement in Geneva for a public health emergency of international concern, or whether Africa CDC makes a pronouncement on a public health emergency of continental security. The emergency procedures that will kick in are very similar, and indeed, yes, we expect that when Africa CDC is granted this authority, we will be able to focus on outbreaks that are largely endemic to us here in Africa, and in that way response will be faster and containment should also be faster. We do not have to wait for a long time for a pronouncement to be able to be made. So that is our expectation indeed. That is the expectation of the African Union. That is why this request has been made.
Nick. Thank you, Director. Sarah, I hope you got the clarity in between the two declarations. So now we're going to shift our attention to the monkeypox segment because we've got a couple of questions, and our colleague Paul Adekuchu is also requesting the floor to ask a question relating to monkeypox. So Paul, as usual, I know you want to come in live, so you will just raise your hand. But first, before we take Paul, we're going to go to Judith's question on monkeypox. She says, my question is, going by the statistics you have given about monkeypox, not much has changed. Can we comfortably say that monkeypox has been contained? And just in addition to Judith's question, Coletta Wajohi also comes with a question related to monkeypox, and Coletta's question is, has there been more progress in getting more smallpox vaccine to African countries affected by monkeypox? So those are the two questions from Coletta and Judith. Over to you, Director.
Thank you, Judith and Coletta. As far as whether monkeypox has been contained or not is concerned, the answer is no. We have not yet contained monkeypox in Africa, and we continue to work with the affected member states to ensure that we do not have the spread going beyond where it is now. The numbers have slowed down, and that is a very good thing. It shows the effectiveness of the response that has been mounted in the different countries, but we have not yet reached a situation that we can say that this particular outbreak has been contained. And Coletta, in as far as vaccines to address the monkeypox outbreak is concerned, no, Africa has not yet received any vaccines, and we continue to engage with the WHO. As I said last week, it is our position that any vaccines being released and any vaccination for monkeypox that is going to be conducted globally should start with Africa. This is where we have over 10 countries that it's endemic. We have 9 countries affected. We have over 1,400 cases documented. And this is where that vaccination should begin. But at the moment, we have not seen a change, and there are no vaccines that have arrived on the continent yet. Nick?
Thank you, Director. Message is clear. Vaccination for monkeypox should begin in Africa, where there are endemic countries. Before we take our colleagues, let me just remind you of the medium through which you can send your question. Use our WhatsApp number, +251 94550 2310. That's +251 94550 2310 for the WhatsApp channel. You can also use the live raise hand icon on the bottom of your Zoom screen, or better still, you can use the question and answer segment to send in your question. Paul is over question to the director on issues related to monkeypox.
Yes, thank you very much. My first question regarding monkeypox has to do with where it stopped, which is an issue of vaccine. The WHO recently announced plans to introduce a smallpox vaccine sharing mechanism. So what are your thoughts on this, considering it stands the risk of the vaccine only becoming available to countries that are able to afford to pay? And the other aspect has to do with what is at the core of Africa's monkeypox response? Is it getting the vaccines or intensifying public health response such that when there are other diseases too, and that the world is shifting attention to Africa's health priorities will not change with the tidal wave of the global public health landscape? Thank you very much.
Thank you, Paul. We are very supportive of the important tool of vaccines being made available where they are most required. And I repeat that it is our position that when the smallpox vaccines are released to address monkeypox, it should start here in Africa, where the burden is larger, the risk is higher, and the geographical spread is also broader. This is where it should start. We should not have a situation like the COVID vaccines where we end up with Africa not having much in terms of the vaccines being made available. So it is our position that the vaccines need to be shared, but the beginning of it should be here in Africa. For our core response to monkeypox, it is non-pharmaceutical activities where we engage with the public, we give the information, they know what they need to do to protect themselves, and also we increase the index of suspicion of our health workers so that they're able to pick out any possible case as early as possible, isolate them, and provide them with the management that they need. So our core response is really non-pharmaceutical in nature, and for those who are symptomatic, apart from isolation, is to provide them with the supportive management. Vaccines we've not yet started to administer because they're not yet available, and as soon as they do become available, well, there's a protocol in place on who needs to be given the vaccines first, and we will follow that protocol with the affected member states. Thank you.
Thank you, Director, and thank you, Paul, for the question. I think we've got another question coming in from Judith in our Q&A segment, so we will take that. But before we do that, let me remind you again of the means to send your question. +251 94550 2310 is the WhatsApp number, or you can be like Judith, send your question through the Q&A segment, or just as Paul and Sarah did, you can raise your hand and you will come to us live. Judith's next question, she says, the past few weeks, your rallying call has been to African countries to procure COVID-19 vaccines from manufacturers on the continent. Has this situation improved? Are the procurements rising? My other question is, for the second booster jab, when is it safe to have the second booster? That's Judith Akole from the Kenya Broadcasting Corporation.
No, thank you, Judith. And as far as purchase from local manufacturers is concerned, we are still very hopeful that the situation is going to improve, and we are expecting that those who are purchasing COVID-19 vaccines should begin to order from local manufacturers, particularly Aspen down in South Africa. But there is no agreement yet. Neither is there an obligation at this stage, but we are working on that, as I said, in the background to get those who are purchasing COVID-19 vaccines for Africa to purchase those from African manufacturers. So the situation, although there's been progress in discussions, we have not yet had new orders going to local manufacturers for COVID-19 vaccines. For boosters, on average, after 8 months of the last jab, it is advisable at this stage to get your next your booster dose so that your immunity remains high, and that should protect quite well from getting seriously ill if at all you get exposed to the virus. And the mainstay of COVID-19 still remains non-pharmaceutical measures, you protecting yourselves with distancing, with masking, with washing of the hands, and testing as appropriate, so that we ensure that we get to know who is positive and quickly secure the person to avoid spread. But boosters, after about 8 months on average for the different vaccines that are in the market, it should be time for your next booster.
Thank you, Director. I think those are very clear answers to the question from the colleagues. So, colleague, we've just got a couple of minutes left to go. The Director is on the hot seat, as he mentioned at the very beginning that policy organs of the AU are meeting, and the meetings in the few weeks going into July is focused on Africa CDC, and so the Director will be in with us up to 12:45, and so we just got a couple of minutes to go. I see one question just coming in. If you still have questions for the Director, kindly send it through the WhatsApp number +2549455022310, and of course use either of the platform available to you on the Zoom screen. That is to raise your hand, of course, and you can use the Q&A segment of the Zoom screen. Judith have come back, Director. She just needs a clarity. Kindly clarify. Did Dr. Ahmed say 3 months or 8 months?
For booster, I said on average, it's 8 months. 8 months.
Okay, Judith, that's the clarification. On average, is 8 months. Okay, I think colleagues have got a lot of responses today from the Director. Not many questions today, so we are going to just proceed to the final points, the final key points that you will usually want the colleagues to carry from today's briefing for the week, and then we'll call it a close and give you the time to prepare for the next meeting on the top of the hour. So it's over to you, Director. What are the 3 key points that you want the colleagues to carry? And then we can close for today.
Thank you. Thank you very much, Nick, and to all those attending and watching on the different platforms. I have 3 messages today. The first is that COVID is still here. And when we see countries going into the next wave, it is very educative that we should continue to protect ourselves, both using non-pharmaceutical measures. And for those who are not yet vaccinated or those who are vaccinated, please get your next jab, whether it is the first one, or it is the second one, or it is the booster. Please get vaccinated. It is important, it is protective, and we advise that you get your next jab. The second is that monkeypox, although it is endemic in 10 countries on this continent, the risk has increased because the circulation has been seen to happen outside of the endemic countries. So in this way, we also ask members of the public to be aware that monkeypox is circulating. Although it is reported in a few countries on the continent now, the way in which we travel and engage every day poses a risk for us getting monkeypox. And as Africa CDC, we are ensuring that our countries are well prepared. Next week, we have a training for laboratory scientists to be able to expand the number of countries that can be able to do a laboratory diagnosis for monkeypox. So it is there, and our stand, our position is that vaccination is an important tool and needs to start here in Africa for those smallpox doses that have been stockpiled in Geneva. Third is that Africa CDC and the African Union Commission is requesting our member states and our policy organs to give Africa CDC the authority to be able to declare public health emergencies of continental security. This will enable situations like now we have of monkeypox to be addressed quickly as an emergency, instead of waiting for the numbers to grow beyond Africa and then an emergency is declared. That particular authority, if and when granted, is going to make Africa more secure, because we will be in charge, responsible for our own health security. And we are looking forward to our policy organs granting that particular authority, amongst others, to make Africa CDC an autonomous body, stronger, faster, more effective in meeting the mandate that has been granted by our heads of state and government. These are the three messages that I have for you today, and thank you very much. We look forward to seeing you again next week. Stay safe wherever you are, and please tell your neighbor, your friend, your workmate that they too should stay safe during this season as we see the numbers rising in many parts of Africa. Thank you, and have a good day.
Very clear and succinct message. Nothing else to add, just to say thank you, Director, for making up the time for us and members of the media to inform the public through this medium. The thanks also extend to our colleagues, both from the Africa CDC and the African Union Commission, behind the scenes making the briefing to come to us live every Thursday during the week, that the people on the continent can hear what is happening and what their public health agency is doing for health security on the continent. Colleagues, just before we say goodbye, please be aware that the briefing notes, the final briefing notes from the director, and of course the recording of this meeting is going to be shared within an hour after we've ended. So look out in our WhatsApp media group for the briefing notes and of course the recording from this section. With that, we'd like to say thank you. Do join us at the same time, 12 p.m. East African time next week, Thursday, when we are here again. Thank you, Director, and goodbye, everyone.